welcome to this Your Women's Fund, our monthly space that you have chosen to fill with your focus on the brilliant thought leaders who are going to share what you need to know and what you can do to support women and girls, and thus our entire community. Today's Impact Collaborative is an important one. Ask Gun Safety for Youth is our responsibility, and it is our responsibility. I'm going to say right now that this will be a very intense subject matter, and we welcome you to, if it gets to be too intense, you might want to log off or go on mute for a little bit. This will be recorded on our website and our YouTube. You can always come back to it later. So trigger warning is the word. Let's go ahead and thank our brilliant board, many of the members who I see you all logging on now. Thank you for your incredible service. Amazing. Our founder, Marilyn Gladstone, is very, very happy that you're with us today. This would not be what this is. The Impact Collaboratives are only impacting our community because of the amazing folks who are with us today. Many of the people in the audience have also been speakers. You're leaders in your own rights, and your circles are rich. So we thank you for taking this messaging today and carrying it on. We have 4 pillars, and clearly the Freedom from Violence pillar is the one we're focusing on today. The Carrie Meek Foundation has been our generous partner in Freedom from Violence, and that includes public awareness campaigns. This public awareness campaign has been going on now into its 2nd year, informing people of some of the very basic and simple things that we can do to keep our children safe. This billboard campaign is up right now, thanks to the generous support and investment of the Carrie Meek Foundation. And we also have to thank Ballyhoo Media. So if you see those floating digital billboards with this campaign as well, those are pro bono. And we thank Ballyhoo Media for giving those to us as well. So on we go. Vivi, please tell us a little bit about what Data and Research Program has to say about today.
Good morning, everybody. My name is Viviana Varela Pacheco. I am the Senior Research and Policy Manager here at the Women's Fund. And today I'm just going quickly over our Freedom from Violence score of our Gender Equity Index, which was 55 points for 2022. And our Gender Equity Index is a measurement of how far Miami-Dade is from reaching gender equity. For our Freedom from Violence score, we consider domestic violence, sexual violence, human trafficking, and overall violence. Next slide, Danny, please. Here's a QR code if you'd love to learn more. We also have a policy paper for each of our pillars and scores that has a lot more information on why we pick the metrics and what are some of the challenges women and girls face in our community. So I encourage everybody to please scan the QR code and learn more. Thank you.
As I segue to the magnificent Dr. Judy Schaechter, I'm going to recognize the news that's in Miami-Dade that we lost another 11-year-old girl 2 nights ago, right here in the Wynwood Overtown area. She and her 9-year-old brother were found in the room together with a Glock. And that really intense, poignant focusing news is something that we all have to be responsible for. And Dr. Schaechter, we thank you so much for your work day in and day out and for leading us through this focusing moment on what we can do.
Thank you, Maria. I think we all feel that for this family, and I thank you for highlighting it to you and the Women's Fund and the Carrie Meek Foundation for convening this group to work on preventing gun violence across the board for kids in our community and really beyond. So very quickly today, because it's great that all of you convened for the morning, but I know you have busy days before you. I'll plan to share a few facts, some common sense and evidence-based recommendations. And before I do that, I want to tell you a little bit about why gun violence prevention is so important to me. So like 2/3 of Americans, and probably many of you, my commitment to this issue became indelible when I was personally affected. And I would say, like all of you, I've had family and friends who've been directly affected. But for me, it started the personal and the professional together when I was a resident in training out in California. East Palo Alto was the homicide capital of the country at that point. And two boys came in. I was paged to the trauma center. They were 14, both of them, one with a gunshot wound to the head and the other to the abdomen. And we did everything. They were in side-by-side gurneys, and it was a horrific night. We were not able to save them. As the pediatrician there, it was on me to go and speak with the family. I'm sure I was completely incoherent, but I remember very clearly what one of the boys' mothers told me. And she said, they were friends. They had an argument over a girl. And if it weren't for the guns, they would be friends again tomorrow. So that has stayed with me and guided me all my life since. 2 years later, I found myself in Miami, in private practice actually, but learning about the 50 kids under 18 that were dying every year from gunshot wounds. And so I went to join our University of Miami and Jackson to be in a public hospital setting and work with others to address what I consider America's most preventable disease. So I'm going to now share a few facts, maybe more statistics than one is supposed to give in such talks. But because of that, I'll start with the take-home points. Part of that is on this graph, but there are really three, and you'll get these at the end. Gun violence is a real public health concern. It is on the rise. It is preventable, and it is our responsibility to protect our children. And by our, I mean adults, the gun owners, the parents, the lawmakers, the culture shapers, that media influencers online, etc., other leaders, and all of us convened here. So here we go. As the slide shows, in 2017, gun violence became the leading cause of death for children 0 to 24 years of age. As the graph shows also, it wasn't always that way, nor should it be. So think about it. Infections, cancer, whatever a parent is afraid of, gun violence is more common than that as a cause of death. Motor vehicles used to be the leading cause of death, but by far, that has changed. And it's changed because we've logically addressed it in terms of prevention. So despite having more cars on the road and more miles driven, we have dropped that due to law changes such as speed limits, design changes like airbags and car seats, and culture changes like Mothers Against Drunk Driving or Friends Don't Let Friends Drive Drunk. On the contrary, we also have more guns, but we have less legal protections, particularly in Florida. There's little research to inform how we make smart change, and we have more of a gun culture. And those numbers of guns and the gun culture are what contribute here on this. This is not normal, right? The rate of gun deaths in the United States is 10 times our closest neighbor in Canada. This is just not something that should be happening or is at all explainable of what humans do or what we should expect by behavior. We have the data and the systems to count deaths, of course, but that's just the tip of the iceberg. Injuries that aren't fatal are twice as high as those deaths. 3 million kids witness gun violence directly in the room or on the street each year. So with 74 million United States kids, that's about 5% of all kids every year. And what we can't count is the internal injuries, right? The mental health damage, the PTSD, the anxiety, the depression, the grief and the loss. So direct and indirect impacts are there. That may be the ones who experience it, who knew the person who was shot or killed or had the injury. But those who were shot, the loved ones beyond that, the more extended family, school, community members, gun violence may be one of our largest chronic diseases in terms of the after effects. but we really have very insufficient means to identify, to diagnose, or to treat those who are living with it. Why is this so common, and where does it come from? Stay with this slide for a minute, Danielle. If gun violence was an infection, people would want to know the source. For kids experiencing gun violence, the source is the home. The home might be of a friend or a family. Most often it's their own home. That's where the guns come from. And this is true whether the child is the shooter or the one who was shot. And quite frankly, both of them, when we talk about children, are victims. If the child is the shooter, such as kids under 10, 90% got the gun from their own home, from a family or a friend. If they're older, kids who are locked up, juvenile justice detainees in our systems, 80% report that the gun came from the home, their own home, or that of a relative. We know where these are, and we can do something about it. If a child is shot, it's also true that the gun source is the home of their own home, or that of a family member, a friend, or an acquaintance. So 86% of guns used by juveniles in school shootings, a rarity, right, in the whole spectrum of what we deal with, but 86% of those guns came from the home. And 80% of child suicides by firearms, those kids got their gun at home. Focusing on suicides for just a moment, most gun deaths in America are suicides. There are more adults who were killed by this than kids. Well, kids are what we lose more years of their life. So there's more suicides than homicides in our country. 2/3 of adult gun violence victims shot themselves. For kids, that ratio is a little bit reversed. It's about 60% homicides and 35% suicides. The others are what we call unintentional. We could argue whether many of those homicides and suicides with children are also unintentional. But this is still a sizable proportion, 35% being suicides. And it's particularly concerning as mental health and suicidality are at a crisis level and climbing among young people. What's most significant here is the lethality of firearms, right? So suicidality is increasing. But if someone chooses to use a poison, a medication, or some other means, we have a chance to intervene. When the suicide attempt is with a firearm, because it's available, 90% of those are fatal. We can't prevent that after the gun is shot. We can only do it beforehand. So gun violence is preventable. The American Academy of Pediatrics emphasizes this point because firearms are so lethal, because shooting a firearm is so often an impulsive act, particularly in suicide, but with kids, for all of them. Because kids are known to be extremely impulsive. It's one of the things we love about them. Because the source is in our control, in the home, that of a relative or friend's home. The American Academy of Pediatrics strongly recommends access restriction, stronger gun laws, which is very hard in our state, design change, safer gun safeties, gun locks that are only can only be used by the person who's intended to use that gun. And frankly, like this, talking about it. It's become a taboo subject. It is not illegal to talk about this. Even if it's hard to talk about, we have to, because we're responsible, and 4.6 million kids live with an unsecured gun. So guns aren't registered. We don't know exactly which homes have them or how many they have. We don't have definitive numbers, but we do have estimates based on both sales and surveys. We're a country with more guns than people, more than one gun per person, including children. And that was true even before the pandemic. But the number of guns purchased has only escalated. In 2020, we saw an incredibly sharp increase. That's tapered down, but it hasn't dropped to pre-pandemic levels in terms of new purchases. That's still rather high every year. And new purchases means those that were already there are there. So we just keep escalating. All those purchased guns are stored somewhere and too many are stored unsafely. Very many are stored here in our Florida homes. So we need to act. And part of that is asking, as Myra started with the campaign and the billboards, but taking that from a billboard to voice in our home, connecting with people we love and care about, and those we don't even know before our kids go over to someone's house to play or study. That's the Ask campaign. It encourages us to ask if there are guns, if they are locked with ammunition locked separately. Most pediatricians, the vast majority, somewhere depending on the survey, 70 to 90% agree that we should be asking and counseling patients, and yet repeated studies sadly show that less than 10% actually do. So Dr. McFadden and I can try to encourage all those doctors to do more, but I have to believe that parents, the best child advocate that there is, are our best bet, and that gun ownership is a family affair. Guns are in the home and kids are cared for by parents, grandparents, including those who are gun owners. So we got to talk about this. We also have to talk about it because we have to overcome misinformation. We hear too often statements like, my home is safer with a gun. There's research to say, and it's been there for decades and it's been repeated, that is not true. More people will die who you know and love than the likelihood of that risk is higher to the people you know and love than it is of you using that to protect yourself from a stranger or intruder. We need to know that and ask the questions so that we can have a real dialogue. Again, it's not prohibited to talk about this by the Second Amendment. And remember that no parent wants to have that conversation after the fact, or to think to him or herself, if only I had, when it's too late. I'll say too that the conversation doesn't have to be limited to about kids. So Florida has a red flag or ERPO, extreme risk protection order law, that means a gun owner, if one thinks that a gun owner may harm themselves or someone else, law enforcement can petition the court for a temporary removal of the firearms and the ammunition and restrict further purchases. So asking this is about offering help. Asking is about compassion and love, protection and prevention. So there's a great panel lined up this morning. I'm going to stop here. I could talk about this for hours and I wish I never had to. But here's the bottom line on the slide. Gun violence is a disease of epidemic proportion. It is preventable, and it is our adult responsibility to do so. I'll give you some references in the comments. Thank you for tuning in today.
And Dr. Schaechter will ask you to join the Q&A at the end as well. So folks, you can put your questions in there as well. I commit to continuing to be loud, and your succinct, clear messaging here has given me new tools. So I thank you, Dr. Schaechter. I know we've got many, many more. Many of you know this is your Impact Collaborative. Please participate in the chat. Please participate in the polls. Please do the exit survey. That is the way that this becomes ever more your Women's Fund. On to our brilliant, brilliant panelists who will do now the absolutely impossible thing of introducing themselves for 2 minutes or less. And that is possible only because they're going to introduce themselves in context of our webinar today, not all of the brilliance that they're acting in their day-to-day lives. So please join me, Danny. We can go ahead. And we're going to welcome Dr. Terry McFadden. Thank you so much for being with us, Terry. Please do self-introduce.
Thank you, and I'm starting my timer. I'm Terry McFadden. I'm a general pediatrician and professor of pediatrics at Emory School of Medicine in Atlanta. And I am very involved in all sorts of injury prevention, from being part of the executive committee of the AAP National Council on Injury, Violence, and Poison Prevention, a role that Judy Schaechter encouraged me to pursue. I first met her, Judy, that is, at the Injury Free Coalition for Kids in our national work around injuries of all types, but especially over the last few years around gun violence. I will say that Judy, although petite in stature, is a giant among people when it comes to the way she stood toe to toe to make sure that pediatricians and other healthcare providers were not muzzled when it came to talking to families about the importance of keeping their children safe from firearm violence. I'm also one of the founding members of an organization called Georgia Clinicians for Gun Safety. And that organization was born out of frustration amongst emergency medicine doctors, pediatricians, family medicine, all sorts of folks, physical therapists, you name it, who are tired of seeing children who die or need to be put back together again. And finally, I'm a member of the Georgia chapter of the AAP Injury and Violence and Poison Prevention Committee as well. So I have traversed in my career from being really focused on unintentional injury to actually moving into this space of violence as the data and our milieu has changed. So I'm really excited to be here with you today. Just grateful that you all are taking this issue on. The injury burden, I'm almost out of time. I'm just going to say that this slide is one of the most provocative and educational because it shows you that injury prevention is the leading cause of death for most children. I mean, for most people, 1 to 44 years, actually. And you can see in green and red that suicide are the next causes. But there's the human toll that Judy talked about as well. Next slide. And I'm done, I promise. And she's already shared this graph with you. But the other thing I wanted to say before I stop talking for real this time is that our Surgeon General has recently declared that gun violence is a public health crisis. And we've all known that. But to have that come out of our federal government is a real step forward. Thank you. Very excited to be with you.
Perfect segue. We're grateful for you being here, as we are very grateful to have Debbie Mercasel-Powell with us out of your busy schedule. Thank you so much for bringing your talent here. Debbie, please.
Oh, no, thank you so much, Maria, the Women's Fund, and yes, the Carrie Meek Foundation for holding such an important discussion, a discussion that we should be having every single day, especially in our state. My name is Debbie Mercasel-Powell. I'm a former Congresswoman, and I'm talking to you as a gun violence survivor. This is an issue that I've been working on for many, many years. It's one of the reasons why I wanted to serve in the U.S. House of Representatives. I lost my father when I was 24 years old. I received a call that my father had been killed and shot by a criminal with a gun. And it was a moment that really changed my life, my trajectory, the work that I've dedicated myself to. And it's a pain that unfortunately has bonded me with too many families living here in the state of Florida. Right now, the state leads the nation in mass shootings. We have already seen 18 shootings this year alone, 18 mass shootings this year alone. And it's tragic that we are starting this conversation after witnessing yet another shooting of an 11-year-old child in our own community. Giffords Law Center, which I have been very honored to be able to participate with and working with Gabby Giffords, also a former U.S. House representative who was also a victim of gun violence, has been conducting studies throughout the entire country. One of the things that Giffords has done, it has released a state report card on what states have passed gun safety reforms and which have not. Unfortunately, in the state of Florida, just last year, the legislature in Tallahassee passed an incredibly dangerous bill, the Permitless Carry Bill, which allows almost anyone now to carry a loaded gun in public, concealed, without a permit, without a license, and many times without a background check. There's a lot of disinformation, like Dr. Schaechter said. The issue that we have been facing in our country, one of the reasons why we continue to lose our children to gun violence as the #1 reason of death for children under the age of 18 is because of this disinformation. The NRA and the gun lobby have been extremely effective in targeting their membership, in creating fear among their members that the government wants to take away their guns. saying that it goes against the Second Amendment. The Giffords organization has been very clear that our top mission is to save lives. And there are over 100,000 gun owners that are members of the Giffords Law and the Giffords organization working on this issue to make sure that people understand, that they're educated on how to have safe and responsible gun ownership. One of the things that I'm extremely concerned about, Maria, that I think it's very important for everyone to know is that they passed this bill last year. We started seeing immediately an increase in gun violence in the state of Florida. But what we know is that they don't want to stop there. They do want to pass an open carry bill if they, again, in this election, win the supermajority, which would pose even more major dangers to not only our children, but our community. We also know that over 6,000 women lose their lives to gun violence in this country because of domestic violence. And we saw the Supreme Court take on that case that would allow a partner to, to carry guns and to have guns even after committing any sort of violence against their partner. So we're in a point in this country where disinformation has divided our nation. This should not be a political issue. I can tell you that having roundtables across the state and talking to many Floridians, this is an issue that most Floridians agree with. Everyone wants better laws that will prevent this senseless gun violence because, as I think the other panelists have stated, this is preventable. This is not an environment that we should accept as normal here for our country, for our state. And so there are a lot of things that we can do, and we can discuss it later. But there's one bill that when I was in the House of Representatives, besides the universal background check, which we continue to talk about, but there's one, Ethan's Law, which would require anyone holding a gun in their home to have safe storage of those guns. That would prevent tens of thousands of accidents in our country and also deaths for children. And with that, I'll pass it over to you. Thank you so much, and we'll continue.
No, perfection. Yeah, I hope we get to all of those incredibly important tools. Again, could not be more honored, Denise Brown, to have you working in our community and spending your time to share your leadership with us today. Please do your best to introduce yourself as you hear in these 2 minutes. Such a rich life. Thank you again, Denise.
Good morning, everyone. Thank you so much for inviting me into this space. Oftentimes it's difficult as a mother who had her son taken and all of his best friends by gun violence. It's difficult, but I know this is very important, these conversations, and I want to say thank you so much for inviting me here. My name is Denise Brown. I'm a Faith in Florida Live Free organizer, and I'm also the CEO and founder of RJT Foundation, which is a nonprofit organization that helps families, youth and families who lose their loved ones to violent criminal acts. I got involved with this work after the death of my son and all of his best friends. Sadly, they grew up together, but they were all taken by senseless gun violence at the age of 20. They were both expecting fathers who never got the opportunity to see their children. And it was a devastating impact on our family. And doing this work, I realized not just our family, but it impacted our entire community. After his death, neighbors were coming by, co-workers, and people who I didn't even know that he had an impact on. So the impact of gun violence, it's costing our communities a lot. Just in Miami Gardens alone, the impact of gun violence is over $1.2 million if the person dies. So I'm excited to be here to share more. And thank you so much.
I'm going to thank you again in the name of everyone who's joined us today. Denise, thank you so very much. So quick focusing on what we need to know. What is the cutting edge information that we need to know? Terry.
Sure. I think I always like to talk about suicide, as Dr. Schaechter has mentioned before, because when we think about some of the things that we can do, like safe storage, we think about unintentional firearm injury, and we maybe think about assaults, but we don't always think about suicide. And I think it's striking what we're seeing in terms of the increase in suicide rates for our young people, particularly the 10 to 14-year-olds, which is really quite striking. So think about how safe storage not only protects from unintentional injury, but from suicide as well. On the next slide, I just wanted to point out another issue that I think is really important for us to think about, and that is the firearm injury disparities that we're seeing. So while we're seeing an increase in firearm injury over the last few years, we are also seeing significant disparities with Black and American Indian and Alaska Native children and people being impacted even more strikingly. And so, again, as we think about what we do, it's important to think about these groups. In my last slide, I just want to go over a few of the facts, I think, as the American Academy of Pediatrics has sort of delineated them. And as Dr. Schaechter has referenced, firearms are ubiquitous almost in our society and in our homes where children are right now. And, you know, I started out my career saying 20 years ago plus saying the only safe home is the home without a firearm. And so end of discussion, that's it. But the truth is firearms are so ubiquitous that we have to talk about them. And 43% of them have at least one unlocked firearm in their homes. And we know that laws that reduce access work. They work for the things that I've talked about previously. We know that suicide attempts, as Dr. Schaechter has mentioned earlier, are often fatal, 91%. So if you take, you know, a drug, you use other means for suicide attempts, you're much less likely to have a fatal outcome. We don't get a second chance when children use firearms when they attempt suicide. And finally, just like we've been able to reduce the rates of injury for car crashes, injury, and death, we did that through a series of interventions. But one of the big ones is around counseling families and making sure that families have the agency to protect their children, whether they're in their homes or in the homes of friends and family members. We know that as physicians, this is a big role for us. This is something that we have to take on, and we have to figure out how to do it well. Thank you.
Thank you, Doctor. Debbie, you mentioned some really important issues. Have you got a few more for us? Got about 3 minutes for this section.
I can also, like some of our friends, panelists today, I can talk about this issue all day long. I would say that one of the biggest challenges that we're facing here in our country is the politicization. I'm using my Spanish here of this issue. I was very, very surprised when recently, just in June, just a few weeks ago, we were recognizing Gun Violence Awareness Month. And I visited the county offices, and I was very grateful for the mayor and for some of the commissioners to recognize, you know, one of those days in June as Gun Violence Awareness Month and Day, and recognizing all the survivors and all the organizations like Moms Demand, Everytown Giffords, of course, and some others that have been working on this issue, just trying to save lives. It's very simple. The mission is to save lives here. And it was very clear to me, who was not standing next to the mayor and some of the commissioners, recognizing that it was Gun Violence Awareness Month. And I think it's time for all of the citizens of this country, Floridians, to hold our leaders accountable. Right now, we know that there are over 390 million guns in this country. If more guns made us safer, we would not be in this high rate of gun violence. We also know that the economic impact is over $550 billion that gun violence is causing our nation because of the high cost of healthcare. Like Dr. Schaechter shared her story. We are seeing more and more ER visits because of this community violence that we're facing. And so I think that the biggest challenge and the biggest issue is the fact that we have leaders, elected officials in all, whether it's local, state, or federal offices, that are not doing the work, that are not prioritizing this issue. They are prioritizing the gun lobby much more than protecting our children's lives. And we also understand that this is an issue that impacts communities of color disproportionately. We have a much higher rate of gun violence in communities that are Black communities, Latino communities, much more so, even twice as high, sometimes even 3 times higher than white communities in our state and in our country. And so we need to stand up, and we need to have the courage to speak. We need to have a much better communication and education of our voters to be engaged, to understand who is going to prioritize this issue, who is going to take on the gun lobby and pass common sense gun safety laws. Again, this is not about changing the Constitution. It's not about taking guns away from anyone. The Second Amendment is the Second Amendment. We do support responsible gun ownership, but we have to pass laws that we know are going to prevent more accidents at home, that will prevent community violence that is causing not only our children to die, but also it's affecting law enforcement. Many officers, many police officers were very much troubled to see that the legislature passed this permitless carry. It puts them in harm's way also. It's almost impossible to know who should be carrying a gun in public and who shouldn't when you have these laws in place. And so I think that we need to better educate the public on this issue when they have the information in front of them. And I can tell you it's a top of mind issue everywhere I go. They make the right choices, and they need to remember that they have the power to make the changes, not only by holding their elected leaders accountable, but also by having that information and discussing it at home with their friends, with their neighbors, and at schools.
So powerful. Thank you so much. Yeah, we need to be loud and in so many languages, whether it's linguistically, whether it's in numbers, like the billions of dollars. It's there's so many different voices that need to be heard and shouted. Denise Brown, please do tell us what you'd like us to know.
It's important that everyone be involved in gun violence, community violence intervention and prevention, because this is just not a Black or brown or Democrat or Republican issue. Gun violence is affecting our entire country. It's important for us to stand together, to advocate together for community violence intervention and prevention, and not become complacent. Oftentimes, people in our community, we see it, we hear it all the time. So sometimes people just become complacent, and we can't afford to do that because it is the leading cause of death among children, and that's very alarming. So as a mother who experienced this firsthand, I'm here to tell you that this is something that I wouldn't wish on anyone, because it hurts so bad, and the mental part of it, you just never recover from it. It's something that stays with you until you leave this earth. And if we don't take action and do something about it now, I just can't even imagine how much worse this would be for our communities. The mental health, there won't be enough people to take care of individuals in our community who are suffering from mental health issues as it relates to the impact of gun violence. So I would encourage everyone in our community, don't look at it as that this is an isolated incident or this doesn't impact our community. We don't have those issues over here. Gun violence can impact anyone at any given time. I often say that death is a frightening thing that has no face, no name, no age, no color. And that's what gun violence is.
Incredibly profound. Thank you, Denise. That's very powerful. What can we do about it, Doctor?
So there are several, as injury preventionists, there are several big bucket categories that we think about when we talk about preventing injuries in general and firearm injuries in particular. There are new product innovations like smart guns and guns and safes that have biometric properties that only allow the person who purchased and hopefully registered the firearm to use. There's legislation and policy, and that is a big place where I think we all can intervene, whether those are safe storage laws. And the thing about safe storage laws is that regardless of which category you're talking about, they prevent unintentional access to firearms. So whether that's, we think about the mass school shooter, again, storage keeps that away from those hands. You think about community violence, if you think about unintentional or suicide. Safer environments where we have gun safes and gun locks and appropriate storage procedures. And then family education is so important. But that's where, as Dr. Schaechter mentioned before, we probably have fallen behind and we can do better. Next slide, please. So counseling, another way that I've traversed my professional journey is that rather than spitting out information to families, counseling really has to be a conversation, understanding what people's fears are, their barriers, the myths that a gun in a house makes it safer. You have to be able to have conversations in order to get to that. Next slide, please. So as we think about counseling, again, I have become educated myself. You have to respect the parent's position. You have to be non-judgmental as you're having these conversations. You have to recognize for families who are not thinking, they're thinking maybe about unintentional, but they're not thinking about suicide. You have to think about what happens in another person's home. And this is where the Ask campaign comes in. And then you have to think about how you keep those firearms safe if families decide to use them. Next, please. So when you think about tips for parents, and I'll run through these really quickly, out of sight is out of mind, keeping those guns out of sight and for children because they find all sorts of birthday, Christmas, Hanukkah presents, right, when you think they're hidden. Locking the firearms is really important. Storing them alone without ammunition. And then talking to children, making sure that they know that if they find a firearm, they should not touch it. They should go and find an adult and tell them about it. Next, please. That you dispose of firearms that you don't need. Having all of those firearms accessible to children is only going to cause disaster. And then empowering the children, as we talked about before, and asking when visiting another home. Next, please. And then thinking about youth violence. And I won't go through this in detail, but just thinking about for our older children, why they may feel unsafe and why they may feel the need to use a firearm or carry a firearm. Next, please. There are resources from the AAP that you can access. Next slide. And these are some video trainings that pediatricians are starting to be able to participate in that give you the opportunity to actually practice and role play and understand how to have those conversations with families. Next. And these are some graphics that can be used for social media or for traditional media that really help get the word out about keeping children safe, that it is our responsibility as the adults, that children are amazing and curious, but we have to keep them safe. Next slide. And then finally, this is an example of a resource developed by my own AAP chapter in Georgia, both for clinicians to help us educate clinicians who don't always know what best practice should be, and then for families that really hopefully empowers them and gives them agency to be able to keep their children safe. And the rest are just resources. But, as you think about what your role is, we have many.
Thank you so much. Such important resources. Dr. Debbie, please, your key takeaways. What do you want people to think of when they leave today?
You know, I think a lot of us sometimes feel like, you know, what can we do? There's nothing else we can do. There's another shooting. You turn your head, you keep going, and you feel like you're living in a country where this is just going to be the new normal. And I'm here to tell you that it should not, it will not, and all of your advocacy is needed here. I think that it's incredibly important for all of you to make sure that you're empowered and you call your representatives, whether it's your Congress member, whether it's your state legislature, to let them know how you feel about the issue, to tell others to do the same thing. There's a lot of power in those phone calls. I can tell you, when I was in Congress, we paid attention to the amount of calls that we would receive on a particular issue that was important to my district. And so elected officials pay attention to that. So advocacy, participating in the system, becoming much more active on this issue as it pertains to holding your leaders accountable is incredibly important. I think it's important also for you to go to Giffords.org and look at all the work that Giffords does. You can also volunteer, get involved. We hold a lot of roundtables across the state. We hold a lot of events. A lot of the work that Giffords does is work directly with the legislature just to advocate for better laws and for more gun safety reforms. And last, we have a lot of funding that can help community violence prevention programs, and many organizations that are small, that are local, that are doing incredible work to keep kids off the streets, to help families that are working, two jobs, that don't know what to do with their young children. They don't want them in the streets, and they're helping them, they're mentoring them. We need to support those programs. We know that early intervention is what works for a lot of the teen violence that we're seeing in these communities. And the Bipartisan Safer Communities Act provided significant funding. If you don't know how to have access to that funding, make sure that you contact your local Congress member. They should be able to assist you on how to access those funds, but also you can reach out to Giffords and see if there's a way that the organization can also link you to, different places that you can apply for those grants, because I think that we need to be much more active in supporting these community violence prevention programs that we have already doing the work in our communities in Florida.
That's very helpful. And actually, I learned something. We have so many amazing people in the audience with us today: Overtown Youth Center, Guitars Over Guns, and I'm not going to try and mention everybody. Amazing folks here. Denise, your own organization may have some tips there of places that you can apply for additional grants for your amazing work. What are your key takeaways, Denise, that you'd like us before we go to the Q&A?
Education and empowerment and advocacy is important, and all of this works hand in hand. Just encouraging folks to be involved, support in any kind of way through standing up, speaking out, and taking action. Feel free to reach out to our organization to find more ways of how you can help us to help others, turning their pain into a purpose. And thank you so much again for allowing us to be a part of this space.
Thank you for all. Dr. Schaechter, we're going to ask you to please join us for the Q&A as all of our participants participate in the poll. We thank you so much for that and for being a part of this incredibly powerful impact collaborative. The first question, it might be for you, Dr. Schaechter or Dr. McFadden. Leah Janae from ICU Baby is asking, she recalls a while back that her pediatrician was prevented by law from asking if there were guns in the home as part of a children's checkups like he wanted to. Is this still true?
Since it's a Florida law, Terry, do you mind if I take that?
Please.
Thank you. So Terry was making reference to that in her introductory remarks. Thank you, because I didn't really I think I forgot to introduce myself. And also shout out to the Melissa Institute, because I'm on their board, so they're here joining us. But yes, Florida had an incredible and horrific law that was on the books for 7 years, which we called the physician gag law, that said that no healthcare provider could ask about firearm access, right? Which we know is a means of getting information to then give parents and others information to prevent that. Family medicine and pediatricians came together, the American Academy of Pediatrics, the Florida chapter, individual pediatricians, and led the effort to overturn that. So we were successful. That got overturned in 2017, I believe. So this is just like asking about what did you have for dinner last night in order to do nutrition counseling or blood pressure counseling, or how much exercise do you get. This is a means to have information so that we can help families keep kids and others safe. It is completely legal to do so, and we teach that in where Terry is in Georgia and in our medical schools here too.
Thank you.
One of the many reasons Dr. Schaechter is one of my sheroes, because again, she stood toe to toe with the lobby to make sure that families can be educated. It's insane.
Thank you. Thank you. Question about how do we deal with political resistance to research on gun violence? This is from Mark Needle from University of Miami and beyond. Yesterday, the House Appropriations Committee issued policy riders in the federal budget that would again make this illegal at the federal level. Would you like to take that, Debbie?
Well, yes. And when I was in the House, I was a member of the Judiciary Committee, and we actually passed in the House, and it was signed into law to allow the CDC to study the effects of gun violence on our society and our community, and to do research on where it's coming from to understand this issue better. As you can see from that bill from the Appropriations Committee, they weren't very happy with that. And it really is just to support the gun lobby. The gun lobby is very effective in putting pressure on these politicians with huge campaign contributions to make sure that they don't pass any sort of legislation that would prevent easy access to guns. Why? Because of profit and enrichment. But we have seen some really great steps through the bipartisan Safer Communities Act legislation, and also finally appointing a director to the ATF that is trying to close some of the loopholes that we have in the law, specifically being able to purchase gun parts online and then building your own weapon. That should now be illegal. And also making sure that we crack down on trafficking, the gun trafficking that we have seen. A lot of the work that Giffords has been doing is also conducting studies. And one of the studies that we found is that a lot of the guns that end up in Haiti, a lot of the guns that end up in Puerto Rico, where we see incredible rates of gun violence, is they come here to purchase the weapons in states like Florida, where they have very lax gun laws, and then they bring them back to these countries. The ATF is right now monitoring that and is really doing a much better work now that we have a director that was appointed thanks to this administration. But advocacy truly works, and raising your voices work. We must be able to use funding to study the effects of gun violence in our societies. The cost, like I mentioned, over $500 billion, healthcare costs. The cost of inaction is too high in this issue. It's not just that it's costing us billions of dollars, it's costing the lives of our children, of our loved ones all over the country. And so we have to put pressure, and it starts here in Florida, because what I'm seeing is a legislature that is trying to go backwards on any sort of progress that we made, especially after Marjorie Stoneman Douglas. They are now lowering the age to purchase weapons. It was raised to 21 years of age, and they want to lower it to 18. They held off, but this will be a bill that will be introduced in the next legislative session.
Maria, can I add a little bit on history and proportionality about research? So when I referenced what happened with the motor vehicle crashes, deaths and injuries coming down, that's because of research, a very careful research that was done that really taught us, even laws people didn't necessarily want, like I don't want a speed limit. Okay, I get it. But we can quantify how many lives are saved by that. We can quantify how many kids are not dying in drunk driving crashes because of what the alcohol ages are, right? That came about from research, and that's true for anything public health. It's true for almost everything in diseases, right? So So tobacco kind of similarly. And those industries didn't want us to do that initially, right? And people said safer cars won't sell. Well, they do. But we had to have the research to do that. Nobody would think that car safety or road safety is a political issue now. Nobody would think that lung cancer is a political issue now. So we need to make sure that we protect the tiny bit, right? The representative is correct that we did not fund this for 25 years. Go and look up the Dickey Amendment. And that meant we had very little progress. It was all only privately funded. Now we have $50 million split between the CDC and then NIH. That is a drop in the bucket. Here's the proportionality. If you compare what we spend on any of those diseases that don't affect as many people, important work around cancer and stroke, etc. Those things get way more per victim or person affected than we do for gun violence. So we need to not just protect this, but grow it over time to make a difference and save lives.
I completely agree. Just to riff off of Judy's last comment, if you remember the graphic that I showed that showed you the 10 leading causes of death, for 1 to 44-year-olds, injury is the biggest cause, and firearms are right there in the mix. So why would we not, now that we know, although many of us have known this for years, that this is a public health issue, why would we not research it? So we lost 25 years of research time. At the same time that those the car crash fatality rates were going down, firearm deaths were increasing. So we have to be vocal. This is our lane. This is definitely our lane. We all have to be advocates. We cannot go backwards.
Which is an important segue. That's why we come here. We come to focus, and it's easy to become numb. There's so much going on. We come together to be able to focus. There's a question about most effective gun safety advocacy groups to support. Denise, I think it's important to say there are huge organizations and there are smaller organizations like the one that you run, Denise. And I'm going to put my opinion in here first and then tip it to you to see if you have anything to say. I feel like they're both incredibly important. The big machine and the real human machine working day in and day out in the neighborhoods. Denise?
That's absolutely true. Not only do we have RJT is more geared to helping families cope and helping them to rebuild their lives and be able to learn how to share their stories. Whereas I'm a member also of Everytown for Gun Safety for many years and Moms Demand Action. Those are the larger groups that I think do a lot of work, phenomenal work. And Faith in Florida, we build more power in the community for them to stand up and encourage them to be involved with these types of groups. So I think both big and small are important. With the smaller organizations, we're right there on the ground doing the work. We're hearing the stories. We're seeing the bodies in the streets. I've gone to homes and I'm literally sitting on the floor with families who are just devastated because I know I was there. And I knew when this happened to me, I didn't trust anybody. I looked at everybody like they were a suspect. So both big and small organizations need to work hand in hand. We can bring those impacted people into the larger audience and encourage them. The lemons that were thrown to them, turn them into lemonade. Stand up, speak out, get involved. In the larger organizations like Mom Demand Action in Everytown, they have so many different programs to teach about legislation work and sharing their stories and just, helping you to cope. So there's so many, when this happened to me back in 2012, there weren't a lot of opportunities and resources out there. So I see the change in it, and I'm happy that more people are getting involved because at one point, a school wanted me to come and talk, but I was shunned because that school said that, oh, this doesn't happen over here. That subject is too strong for us. And, I was hurt. I was offended because I'm like, they don't understand that this has no name, no face, no age, and no color. This can happen anywhere. And just a few years later, it happened in Parkland, one of the safest communities in our area in South Florida.
So,
And so
so
no
we're
one
going to
was
invite everyone to continue in contact with you, Denise, with each and every one of you. There are amazing other questions here, many policy issues. I know that our team has the opportunity, has shared much of your contact information. I know Representative and the Giffords Foundation would be very happy to answer some of these other questions about legislating billboards for gun shows, etc. So the conversation grows and continues from here. So many rich resources were shared, even though Dr. McFadden and Dr. Schaechter had to go quickly. Those slides are there. You can pause this on a recording. We have this on our website. We invite everyone to please join your Women's Fund in amplifying these voices, this information. You can be one of our impact agents, our volunteers, and you can always please continue to fuel our mission by joining us with your time each first Thursday of the month. We're going to have another incredibly important issue next month. We're talking about economic mobility and the incredible possibilities that there are for women who are categorized with having neurodivergencies and disabilities. So we invite you to come back. This is your Women's Fund. Thank you for participating. Have a powerful day.
Bye.
Panelists and speaker, thank you so much. Danny, do you want to bring everybody back on? Thank you so much. We could have done a full day on this for sure.
Thank you so much, Mara. I have to log off, but thank you, everyone. And thank you to the panelists. I want to talk to all of you offline. This was wonderful.
Amazing. Thank you for being here. Your
Thanks for
precious
joining
time.
us.
Thank you, everybody.
Wonderful
Dr.
discussion.
Schaechter.
Is that Ms. Brown?
No, it's Maria.
Oh,
It's
okay. Can I
Maria.
just quickly say, in case she goes up, Ms. Brown, thank you for the work you do. It is a huge sacrifice that I'm sure is painful all the time and so meaningful to across our community. And thank you for the strong reminder that this is everyone's issue. I admire that. Terry, thank you for doing this for me. You know I love
Thank you for
you.
inviting me. It was wonderful. As always.
Amazing. So Denise, whatever you want that key takeaway to do, we have Natasha, you don't see her there, but we got a great social media team member, who will get some of your messages out. So if you want to work with her and grab one thing that you want to be your quotable quote or to drive people to you, please, we're here at your service to thank you. And we want to amplify the voice of all the work that you're doing. And the same thing for you, both of the doctors. Anything specifically that you want on our socials, Tasha's good. So she can grab a piece of a quote from what you said, but if you have one thing that you'd rather do or a link, say so much to say, I want to drive you here to these resources. And I'm gonna ask you to act. Here's a resource. Just promise to act, to do one thing.
So send an email to Danielle?
Yeah, Daniela can take care of
Okay.
one-stop shop.
Great. Thank you guys for putting this all together.
No,
Thank you
thank
so
you all
much.
so much,
Thank you
and
for your
we'll ask for
time.
your help to continue
Yes.
to go. Okay.
Very
Thank
nice to meet all of you. Have a great day.
Thank
You
you.
too. Bye.